Hey y'all, just ending the day. Long day here. Good day. It was a Friday. And you guys are about to watch part two of podcasts that we had with uh, Wheelhouse Digital Marketing Group. And in this part two, we're talking about our faith as a company, our core values, our mission, why we do what we do, and really highlighting for me specifically why I feel called to this industry and why our company is here to serve patients in home health, hospice, and veteran care. So I hope you enjoy this part two of great podcasts with Wheelhouse Digital Marketing Group. So take a look.
How do you think of your mission as an organization, particularly with regard to hospice?
Yeah, so we're faith based. As a kid, my mom said that, but I kind of, as I got older, like understood what does it mean to honor God in what you do and in your work, and so as an organization, we try to do that to the best of our ability. And so when we honor God, that means when no one's looking, we're taking care of people the best way we can, and so. I think when it comes to mission in terms of healthcare, I mean, when you think about why healthcare was started, you have to think of the other person as better than yourself when you're a clinician. So healthcare is that. It is thinking of the other person before yourself. And so, when we are taking care of people, when we are even doing a podcast, like my heart is like, I hope that this is going to help someone to think about if they're thinking about going into the industry, it's about other people. It's about serving. That's what healthcare was meant to be. It's not like, no offense to McDonald's or no offense to Burger King, you can just serve food, right? But this is people that you're serving. And so I think when you're talking about mission, that's really what it's at. It's about thinking of the other person as better than yourself.
So when we were exchanging emails and we were chatting with Grace, I know we were talking about the topic of hospitality
Yeah,
and exceptional care.
yeah.
What does it mean in the context of your work and the work that your staff does to extend hospitality to the people you serve?
It's essential because it's like you're putting yourself in their shoes, right? If you were sick, how would you want someone to come to you in a hospital room or at home taking care of you if you were feeling terrible? You would hope that they would be genuine, that they would be kind, that they would be excellent in their craft and their skill set, and that they would be doing everything that they can to help you get better. Or if there was no prognosis for you to get better, that you would pass away with dignity and respect and honor. And so when you're talking about hospitality, it's huge when it comes to home health or hospice care or healthcare because you're taking care of people in a vulnerable state and they're going to lash out at you. They're going to like yell at you. They're going to be upset because they're dealing with their own emotions. But the hospitality is really about not taking offense to that too. Like we talk about like sometimes we're just punching bags. That's just what it is. You can't get offended. We're in an industry where you're going to feel that way because people are going through emotions. And so when you're talking about hospitality, it's about the intentionality of how do you take care of people and being intentional about tone, being intentional about being, how do you talk to someone, you know, um, just being respectful, of all different cultures, races, sexual background, whatever it may be. It's you're a human being. We're going to take good care of you, and that's good hospitality. So that's kind of what I see.
Hospitality is core to the way that we engage with one another, with our clients. It's a core aspect of our culture. I like the definition of hospitality being the difference between when something happens to you versus when something happens for you.
That's
It
good.
can happen to you, and that's not hospitality. If it's for you,
Mm,
that feels that you're being cared for. I would imagine that
yeah,
there has to be a lot of anxiety associated with
yeah,
hospice care in particular, or even home health care.
yeah,
I mean, this thing has happened that is outside of
yeah,
your control.
yeah.
I wonder how your team members, or maybe how in your own practice before becoming CEO, how you can think about how you can create a context in which it feels like something is happening for
Mm,
the person you're caring for.
I think it's realizing that everyone's human. We all have the same interests. We all have the same things that we enjoy. And that helps to foster that hospitality, right? So I'll give you an example. Like I like to go, I'll go to hospitals and meet with families who are potentially needing hospice care. I'll meet with them and meet with their loved one to meet with their family. And recently I met with a family member and end stage cancer, not looking good. We went through all the medications and with the social worker that was there, and they reached out to our agency. And so I like to just go and meet with them sometimes, just to kind of see what's going on. And so I met with them, and you could tell the husband's eyes were like foggy, like they had been married for 50 plus years, deer in headlights. Like I have no idea what I'm about to walk into. And so we started talking, and instead of me going into like what is hospice, the jargon of like this is the benefits and stuff like that. I just started talking. I saw he had a shirt on, and I was like, "Oh, what school did you go to?" And he told me the school. I was like, "Oh, I went to that school. It's a Jesuit school." And he was like, "What? My son went to this Jesuit school." So we just started talking, and we started talking about football. We started talking about track, and um, he's a big Steelers fan, and so we just started going in on that. And you could tell he was just like, "Ah, this is great," and like, and then at that moment in time, he was like, "Okay, thanks. Let's talk about, what I need to do for my wife, you know? And that's the humanity. I think that's what the hospitality is. It's not just going in there and just, providing a service. No, like I love what you said. It's how do we it's for that person, right? And so I think organizations in general, like you said, CEOs in general, it all starts with the leadership. How do you figure out a way to relate to people, and then from there provide the care.
You run a faith-based organization.
Mhm.
What does it mean that Charlin is faith-based? You talked a little bit about it. What does it mean in terms of the people you serve? I think there may be some misunderstanding about what
Yeah,
it means to run a faith-based
yeah,
organization.
it does. Yeah, so our it's all based on our core values. What do we believe, and what's our foundation? So our foundation is based off of Christian core values, but it doesn't mean that we are going to push a certain type of belief on families and on patients. It is to let them know that this is the core of who we are, and this is how we treat people. And we train all of our staff to believe, hey, you treat people well, you treat people with honor, integrity, excellence, human dignity, and trust, all those things, right? And so when we talk to families, we let them know that. And if they have, especially on hospice, there's a component of hospice that our job is to coordinate with them spiritually. So a lot of times, if they don't have a spiritual faith, that's okay. We just help them from more of a counseling session and helping them process grief and things. But then we have some families who are Catholic or Christian or Buddhist or Muslim or Sikh or all of these type of beliefs. We help coordinate them with their belief, and their community, and connect them to make sure that they are appropriately grieving and appropriately understanding how hospice, how end of life works. And so that's kind of, when families say, "Oh, you're faith based," like, yeah, we are. It's more of like, we're here to serve you. We got to do what we got to do, but we're here to serve you from a
Mm.
background. So
So it's more about who you are, not about who they have to be.
yeah, yeah, 100%.
Shifting gears a little
Yeah,
bit, I was talking with the chief digital health officer for the University of Washington a couple
sweet.
of weeks ago. Yeah, and we were talking about lots of things, the evolution of healthcare, but in particular, the implications of AI
Oh yeah,
in healthcare and how it's being used today, how he envisions the experience of a patient will change in the future,
yeah.
the daily work of a physician might change in the future. How, if at all, is AI impacting your work, your business operationally?
The industry as a whole, and this is just Medicare as a whole, right? Medicare is a government funded industry. It is not cash based. It doesn't adjust all the time towards inflation. It doesn't do that. It's census driven, it's population driven, and if it's exhausted, it becomes exhausted. So, with that said, each Medicare agency has to follow what Medicare's payers are, right, and how they pay them, and then they have to budget accordingly. And so sometimes they don't pay more based off of inflation; they just keep it the same. And so with that, you have to figure out how do you continue to serve patients and families with no adjustments in inflation. How do you do that? So whether it's either volume or you cut costs. And what we've done is we figured out from an AI perspective, there's a lot of things that are tasks that can be done via AI that actually will save overhead costs. And so we've incorporated that from marketing to intake to post coordination with patient care. We use a system in our agency that we've built to kind of help, almost like an AI bot, to help send out things that I would probably have to hire someone to do. And we can't do that because of the way that funds are specifically for Medicare. So AI is huge when it comes to the home health and hospice realm. I see that as a huge benefit. I'm sure, for sure, like as you mentioned with the healthcare industry, it's only going to keep getting more, and a big help for so people can really focus on patients, and then the back end things can be done by AI if it needs to be done.
That's consistent with other conversations that I've had with folks in healthcare about how AI is and isn't impacting
Yeah.
their operations and their care. Can you give a couple of examples of the ways that you use AI today, and how you envision that is going to expand, and what does that look like?
Yeah, a good example is something simple as reminder tools for clinicians and their RN license, right? So built this system that shoots them an email and a text message automatically based on the date to say, hey, don't forget you have your license that's going to be expiring in the next couple months. Please make sure to do this to XYZ. Those are just AI things that can be done, right? More clerical things. That's a good example. Even caring for the team. So we have happy birthday automated texts and happy birthday automated emails and messages, right? That, hey, happy birthday, it's your work anniversary. Like, we appreciate you. Or it's, how do you create that environment where those are tasks that have to be done, but you can intentionally do that to care for someone. And so utilizing that to care for our patients, to care for our team, and we've built that a lot. From a Medicare standpoint, there's a lot of tedious tasks that we have to do to remind on, HIPAA, OSHA, several different things that, we just automate those tasks, and it's done. And so uh, it's a huge help, and we're just getting started.
In your marketing, even in the educational information that you create and you publish, particularly video,
Yeah.
you often, my sense is, you're looking to remove the weight,
Hmm.
the stigma, the gravity
Yes.
that otherwise might be associated
Yes.
with home health care or
Yes.
hospice. You're trying to make it not maudlin.
Yes.
It's just, it's a reality, and it's okay to talk about it out loud.
We're trying to make it to where it's comfortable too, right? To talk about, and fun, right? Like, and normal. Um,
Right.
like, I
I
think,
was surprised that to look at your content and
yeah,
see that some of it's fun, some of it
yeah,
makes you laugh, which you wouldn't associate.
with hospice.
You'd have a preconceived notion that
Yeah,
hospice is going to be a very serious, kind of
yeah,
somber
yeah,
topic.
yeah,
There are no giggles involved.
yeah, yeah. I mean, I think
Good.
that's the thing, is like, it's life, right? Like, we all live in, like, I don't know, it was a couple of years, no, it was a year ago maybe. I think I saw something on that Shaq had a hip replacement. And I was like, yo, let's talk about that. Like, he had a hip replacement. What does it look like to have a hip replacement? That is a big deal, right? That's a normal part of life when you get old, especially being an athlete, right? Like, but it's like, we make that fun. We talked about the Mike Tyson and Paul fight. Like, Mike Tyson's 58 years old. We have patients who just did a hip replacement, and he was out there punching against. Like, we talk about those things and try to relate it to where, oh wow, like, okay, yeah, like, I can have a stent in a cabbage and still do what I need to do and go back to work in 2 weeks. Really, I didn't know that, right? That's life. And I think a lot of times the stigma of healthcare is like, ooh, don't talk about it. But like, everyone has a car. You have to change the oil. You have to change your tires. You have to talk about the car. So why don't we talk about our car, which is our body, and that's kind of that's the heart behind it. So
Yeah. Does that same ethos or sensibility, is it also a part of the care
yeah,
that your caregivers provide?
yeah, people won't listen to you until they feel like that you care about them, right? Until they know in their heart, okay, you care about me. I'm gonna listen to you, right? Like we kind of talked about before. It's like how do you a patient has to be able to understand before you walk in the door that this person has my best interest at heart. They know what they're talking about. They're actually skilled and professional. They have a good game plan on what my doctor's saying, right? And so before y'all you do that, you better have the best bedside manner. You better be friendly to them. You better help them understand that you're here because if you don't, you could be the smartest nurse and the smartest doctor, best best SAT score back in the day. I don't even know what the ranges are now, but but it doesn't matter if you don't have that bedside manner.
I've been through hospice with family
Mm,
members, and I would imagine that there's a point at which when you're sick, you
yeah,
just want to be treated like a person, not like a sick person.
yeah,
So I can envision that, being treated like you still have a sense of humor
yeah,
and you're still a
yeah,
three-dimensional person is
yeah,
probably reassuring.
yeah. We had a patient like a couple years ago, and she was a diehard Cowboys fan, and I had a buddy who worked at the Cowboys, and he was like, we're gonna get her tickets and everything." And she was so excited, but she passed away right before the game, and we were like, but we watched the game at our house, like it was cool, so I think those are the things that is human being, like, man, she loved the Cowboys. Even at that time, I don't think they were doing that good, but she just loved the Cowboys. They're still not doing that good,
Sure.
actually. So
Right.
but
Yeah.
but, like, yeah, I think that's what it's all about, treating people with dignity. Hey, this is Charles with Charlin Health Services. Hope you enjoyed the video. Please remember to like and subscribe. We hope this was a blessing to you, your family, your loved ones, all your friends. Share it. And if you want to watch more videos, here they are. Enjoy, and we'll see you guys next time. Peace.